Good evening to all the folks in North Andover at home. I'm happy to be here. I'm Catherine Ely. I'm a doctorate-prepared family nurse practitioner. What is the flu? The flu is a contagious respiratory illness. It's a virus. It is something that is passed into the nose, in the throat, and the lungs, and it can cause anywhere from a mild illness to a severe illness. Influenza is a virus. It's not a bacteria, so antibiotics don't work. How do you know if you have the flu? Typically, the flu comes on very sudden. It comes on typically with a fever, chills, aches, sweats, sore throat, muscle aches. Common cold is more gradual. It's more of a slight illness. It's more of a non-achy, non-feverish. The flu is sudden, abrupt, more severe. Typically what I see in the practice is people are presenting with fever and very prevalent sweats. It's a virus. So viruses are not living entities. They need a host to survive. So a virus cannot live on this desk unless I immediately coughed on this desk and touched that virus. So a virus is going to die very shortly on inanimate objects. It needs people to be alive. So it's spread from person to person through tiny microdroplets that are spread with a cough or a sneeze or talking. It's spread by a child coughing into their hand and then touching another child, and then that is ingested. You're mostly contagious the day before you get symptoms, and this is why we have such a large volume of people getting sick, because they don't know they're going to get the flu. So a day before you get sick, you are contagious, and you can be contagious for 5 to 7 days after becoming sick. Flu can cause complications. It typically is not an illness that does cause complications, but we always hear about the worst case scenario. That's what makes the news. The complications can be a pneumonia, ear infection, sinus infection, worsening of a chronic medical condition. So for example, if you were a heart patient or an asthma patient, or if you had an immune system disease, or if you were a cancer patient, you could get very sick from the flu. I think the most important thing that I'd like to share with this board and with the audience at home is that get your vaccinations. This is still critically important and still not too late. Vaccination is the way we prevent the flu. There's lots of discussion right now about the vaccinations not working. And flu vaccines are developed by statistics. So they look at last year's flu season, and they look at what is the most prevalent viruses that are out there, and then they make scientific predictions on how to develop these vaccines. The predictions they made this year missed some of the vaccine mutations, but it still is effective. Not as effective as typical vaccines are. Typically, flu vaccines are about 55% effective. This year, they're about 35% effective. But it's still better than zero. Prevention is really key. I call this, to the children I take care of, the Batman cape. Cough into the crook of your arm. Cover your hands with a tissue. Good hand washing. 20 seconds of hand washing. Sing happy birthday while you're washing your hands. Use hand sanitizers. Another very important thing is to stay home. When you get sick, stay home. Take your Tylenol, take your Advil, stay in bed, rest, plenty of hydration, take your naps. It's presented here to this board and the audience to show you how it's a serious thing. Flu, since 2010, has resulted in many deaths, many cases of illness. Many people are afraid of the flu vaccine. They're afraid they're going to get the flu from the flu vaccine. The flu vaccine is made from the antigen, and then it is deactivated. So there is no active flu viral contagion in vaccines. It's an inactivated vaccine. You do not get sick from the vaccination. People who shouldn't get the vaccination are just a very few. For example, if you have a very life-threatening reaction to eggs, and that would be anaphylaxis. Your throat would close, you couldn't breathe, you would need an EpiPen. That would be the only type of egg allergy you shouldn't get the flu vaccine. You need to get a vaccination at 6 months and to the rest of your life. Before 6 months, the way that you prevent illness for newborns up to 6 months is the parents need to be vaccinated. Children in the house need to be vaccinated. That's how you can best protect an infant. We also have to think of vaccination as a public health responsibility. Getting vaccinated means you're protecting your family. Getting vaccinated means you're protecting your community, your schools, your environment. That was maybe my closing comment. It's not too late to get vaccinated. And there's still plenty of flu vaccination around in the community. Manufacturers have it. At national, there is no shortage. You can get flu vaccinated.